Let's call the meeting to order. It looks like everybody is here. We have a full house. Yay. So that's awesome. First order of business, consideration of meeting minutes. Any notes or amendments, changes to the February 16th minutes? If not, I would sure take a motion to approve as presented.
So moved.
Second?
Seconded.
All in favor?
Aye.
Any opposed? Okay. It is time for public comments on the items not on the agenda. We actually have public today. We haven't had anybody at the last couple meetings. If you are here and you would like to comment on anything that is not on the agenda, now would be the time. Are you both here for further agenda stuff? Okay. Well, seeing there's nobody here, we'll move on. Discuss and consider recommendation to approve proposed amendments to the Iowa City Housing Authority's administrative plan in regards to the Foster Youth to Independence program. Are you guys doing that, or is Rachel coming, or? I don't think I've seen the hair. Looks good.
It's mostly the same, just shorter. But yes, hi, Rachel Carter with the Housing Authority. We have a couple amendments to the Housing Choice Voucher Administrative Plan that we have here in front of you. The first of which, emergency housing vouchers were created in 2021 to address a surge in homelessness after COVID-19 pandemic. And HUD has decided to sunset those vouchers at the end of 2026. It's likely that we won't have funding to continue funding through all of 2026. Right now, it looks like probably through October-ish. So the first part of this is just an amendment allowing us to convert those emergency housing vouchers to our regular Housing Choice voucher system. We applied for a waiver through the Department of Housing and Urban Development that allows us to place them directly into the Housing Choice Voucher Program, provided we have an amendment in our administrative plan. So that's the first one of those. Does anybody want to talk about that or have questions about that? Or do you want me to talk about both my amendments and then you can talk about whatever you'd like? Any preferences?
Oh, I have a question about this one.
Yeah.
So what does it mean to be in good standing?
Well, it means that we had to have heard from you in the last year. So, for example, if someone hasn't communicated with us and we have terminated their voucher, they wouldn't be eligible to move to a regular Housing Choice voucher.
Okay.
Yeah. Any other questions, discussion?
No discussion. I mean, I didn't find anything reprehensible in either of the amendments. So if you want to go ahead and touch on the other amendment too, that's fine.
Appreciate that, Kyle. The other one, HUD has vouchers called FYI, Foster Youth to Independence vouchers. Those are vouchers for foster youth transitioning out of foster care and or homelessness, sometimes both, depending on the situation. This is a pretty lengthy amendment because we've never utilized this type of voucher. And we can apply on a rolling basis from HUD. It's a little bit of a unique situation for these vouchers. We have been talking to United Action for Youth and Foundation 2 in Cedar Rapids for referrals for these. Those are the agencies that would be required to be involved per the HUD process. And when they have a referral that meets the criteria, they'll provide that to us. We, in turn, take that information and submit it to HUD in a form, and they provide us that voucher. We can do that on a rolling basis for up to 25 vouchers. And in our conversations with the UAY and Foundation 2, it seems that we can easily fill those 25 vouchers. And it seems likely the current federal administration has indicated this is an area that they'd like to funnel more funds to in the future. So we are also hopeful that while having this set up in our administrative plan right now will allow us to take advantage of future opportunities for additional vouchers or funding. So a really great program. We get the same admin fee rate that we get for our regular vouchers. We get additional vouchers. The only difference in these vouchers to, I'd say, all of the other vouchers we administer is that they are time-limited vouchers. So these vouchers are good for 3 years, unless the youth is participating in our family self-sufficiency program, and then they can have 5 years of assistance. And there are some weird little things that get into there. If they enroll in our FSS program in the second or third year they're in, then they can be up to 6 years. But it is a time-limited voucher, which is unique. We don't have anything else like that. So that's a really basic overview, but as you can see, I gave you 20 pages of information about it, which gets a little dense. You have any questions or?
It's a great program. I mean, it looks, yeah, it's weird that nothing like this has existed here before. I mean, it's such a common sense
Yeah.
kind of approach to it. So, yeah.
Just curious, do you have a sense of how long it takes HUD to approve the individual vouchers when you request them?
HUD states it's within 30 days.
Okay.
We are able to use our Housing Choice voucher funds to fill that funding in the interim while we wait, and then they'll backfill our funding. So even if it takes longer, they'll backfill that, which
Need quickly?
I think there's a chance that it takes longer than 30 days.
Just a question on the emergency voucher allocations. I see this emphasis still on citizenship and possession of a social security card. Is that rule going to be applied across all? 'Cause,
Yeah, unfortunately, those are federal regulations that we don't have any control or decision-making points on. And this federal administration is very interested in ensuring that we continue to document citizenship. It has always been the case that we are unable to assist any person who's an undocumented immigrant with the Housing Choice Voucher Program. That's been the case since the Housing Choice Voucher Program came into existence, and is still the case. And it'll be the same for these, that we do have to have citizenship documentation and a social security card or an identification document that operates like a social security card. So we have 4 or 5 things that we can accept in lieu of an actual social security card, but it's not many things. So yes, and the benefit in this particular instance is that these youth will be working with case management through either Foundation 2 or UAY, and likely already will have that as a product of being a foster youth at some point.
And following that, in the event that we have mixed households for which maybe recent legal refugees who might have not obtained some of those papers required, I know probably it's not possible because of the long waiting list, but in the event that there was a possibility that they would get in immediately, how would such a issue of, I know you talked of the papers, affect other members of the family who probably have not obtained those required papers?
Yeah, well, I'll just speak in general because all the vouchers will work the same, FYI or otherwise, as far as these things go. So all of our vouchers work the same in this regard. Right now, the rule is for mixed status families, we prorate our assistance. So say our rent payment to a landlord, regardless of what the total rent payment was, if our rent payment to a landlord is $500, and of the 2-member household, one of them has documentation of citizenship and one doesn't, we would pay $250. That's the HUD regulation. So we prorate based on number of family members and the total assistance amount we can provide. There is right now a proposed rule that HUD has released that is open for comment currently with the intention of closing the possibility of providing assistance for mixed assistance families. That is open through sometime, I want to say April 21st, but it could be April 22nd, sometime that week in April. If that proposed rule becomes a final rule from HUD, then the Iowa City Housing Authority will not be able to provide any assistance for any mixed status family. And that being said, 1,595 vouchers, we have 3 mixed status families. I am very aware of who they are and how many we have because I'm concerned about what this rule looks like. We have 3 mixed status families right now. So it's not a large number. It doesn't mean it affects those families any less, but thankfully we have a pretty good handle on who they are and how we can provide assistance.
Thank you.
Yep.
Not seeing any other discussion. I would sure entertain a recommendation to approve the proposed amendments to the Iowa City Housing Authority's administrative plan as presented.
So moved.
So moved.
Can I get a second? All in favor?
Aye.
Aye.
Any opposed? Awesome. Thanks, Rich.
Thanks, Kyle. Thank you, everyone.
Thank you.
All right.
Very good programs.
Yeah. Okay, so, the next item on the agenda is, non-legacy aid to agency funding requests. Consider budgets to recommendations to city council. Just a reminder to everybody, this is a time for us to discuss. We can't, questions have already presented, answers have already been returned, so we won't be having conversations with providers or having providers, answer questions. We're just kind of on our own with what we've gotten from the, from the applications and the follow-ups already. I will tell you, I'm going to lead off because I get to and talk about where I came from. So, Bree, you've got the thing up there, the spreadsheet. I had put together a spreadsheet somewhat similar where I added 3 columns. One was prior awarded city funds, like how in the last 3 to 5 years, how much other money has these organizations got from the city? I had a column that was just project totals, like how much are they asking? Because personally, and it is completely subjective, but personally, to me, there's something about somebody coming to us and saying, hey, this $5,000 will mean life or death to a project versus someone who's like, well, this is really just a tiny piece of the giant cheese wedge. And if we don't get your 5,000, I mean, it's not like we're not going to have a hard time coming up with the other 5,000 of our $200 or $300 or $400,000 project. So I just put those in columns, and I have one that's my recommendations. And the way mine comes out is 5,000 to the Community Inclusion Club. It's a smaller project they've only gotten $7,500 over the last 3 to 5 years. 5,000 to Homes for My Peeps. I know there were some concerns because it is new, but that's kind of also, to me, what this grant is for. I mean, this is somebody who has run a successful charity organization out of the Des Moines area, is now in Iowa City looking to do, once again, food stuff. Has not received awards before. I put 5,000 there. I See Compassion, another one who has gotten awarded funds before, but a smaller project total. And then the last 3 were, for me, were Open Heartland, Reach for Your Potential, and Systems, all of who had smaller projects and had not gotten prior city awarded funds. So that is where I was at with the systems. Or which one are you thinking of?
I'm just,
Oh. So that is that's simply where I was at from a first throwing something against the wall. I do believe we should fund as many in smaller amounts as possible versus doing larger amounts, although I also know that sometimes a larger amount that just can finish a project, once again, will be more useful than a $5,000 amount that won't allow 2 projects to be completed. So, Marianne, I'm going to hand it over to you as vice chair. Your thoughts,
well,
unless you want to pass it on.
I'm sorry, what was your other one? You had the,
I had Community Inclusion Club, Homes for My Peeps, I See Compassion, and then Open Heartland, Reach for Your Potential, and Systems Unlimited.
okay.
Yeah. 1, 2, 3, 4. That should be 6 times 5. Yeah. Anybody else want to take just a
Well-
stab or thoughts, or I was going to let you go first.
yeah, I appreciated the staff's memo and their recommendations, actually. I agreed with the, I really like the community, the health, what is it? Community Inclusion Club. But they really, my understanding was they want the money to buy a van. Well, they can't buy a van for $5,000.
Right.
So, I would not necessarily go for that. I really liked, I like the staff's, I got to get the staff recommendations here. Where are they?
And she's got it
Oh,
up there
yeah,
too
Oh, you do?
on the screen here.
Under-
Up there. I can move out of the way.
Let me see.
Is that showing on your screen?
Yeah,
Okay.
they are.
I like the Immigrant Network of Johnson County for $5,000. I liked Open Heartland, but I would consider $5,000 for them. I like Visiting Nurses, although I consider $5,000 for Visiting Nurses and then switch $5,000 for Healthy Kids Clinic because I think that's sort of recommending for health care. And I'm open. I also like I See Compassion. I don't think since the city attorney said that Homes for My Peeps is not a good thing to do because of the one member board right now, I would not support them.
But they've
They could
got
come next year.
But they got more members, right? Wasn't it
Well-
the March meeting?
Just one.
Just one.
Oh, they just added? I thought the memo said they
I
added
think
more.
the
board
executive director is the only board member.
So
right?
when we did the Q&A, the executive director was the only board member, and then he followed up within the last 2 weeks saying that they appointed several more board members within the last 2
Something in
weeks.
the packet that came in.
I
That's
understand.
the
Okay, I
reason
missed
that.
Yeah, it was
think
just
they
within
need
the
a little
last
bit more
couple
work.
weeks.
Okay.
But you had, did you have Agape? No. Yeah, you had Agape.
Well, no,
Oh.
GAFE got quite a bit of money. I think it's great. I would support it. But,
Right.
they got, $7,500 last year.
So you said inclusion. I was just
Yeah.
going to see where we all matched.
I'm happy to plug things in for you too, if that helps you visualize.
Yeah, I was just creating columns for each of us so we could see.
Yeah.
Yeah.
So you had Community Inclusion Club.
No.
Oh,
No, I
What
did
you
not.
say? Yeah. Immigrant Welcome Network.
Immigrant Welcome Network.
Open Heartland.
5,000.
Oh, I See Compassion. I'm sorry.
I See Compassion.
Open Heartland, which is,
VNA, Visiting Nurses,
I got that one.
and Healthy Kids.
Healthy Kids.
And all 5,000.
All 5,000.
So then 5, 10, 15.
10, 15, 20,
And then I'm-
25.
Open.
I'm open.
Oh,
I guess from what has been put out so far, I do feel interested in Homes for My Peeps. I think I agree that this is a really small amount of money, and when you're starting, sort of that like small influx can be a big difference, and probably 5,000 for where they might be, and that just like getting moving could be really helpful. It's not enough to run an organization, but hopefully it would be something to,
Didn't they have something in there about they were doing it and then the owner of the property said they couldn't do that anymore, so they had to move?
I was just going to chime in with one more thing. Through the Q&A process, we asked where the gardens would be because it was a residential address and they were having trouble at that site. They submitted a second site and it's outside of Iowa city limits. So not to say that you couldn't recommend funding and we would work with them to figure that out, but staff would recommend against the one this time.
Okay. Yeah, I just think they need another year of organization,
Sure. That's fair.
another garden season.
Sarah, what else?
Oh, I don't know. I felt like this was much harder this year. than
Does
last
anybody
year.
have, anybody have any that they're strong on so we can,
Yeah.
that we could just throw down and,
this to me was very tough because it felt very, I want to say subjective or open. And so it's like, can everyone just have money?
and the answer is no. Well,
I mean, I understand, but it was tough. I agree, although I did say that, I will say that I missed Homes for My Peeps. I missed that additional information. So I agree they need to wait another funding round. I also-
Stacy, sorry to interrupt you. Would you pull that mic towards you just a little bit? Sorry.
I agree on Homes for My Peeps about waiting. I did miss that update, so I apologize for that. And then on the van, unless they have some additional funding, I think that would be very tough.
who was that? That was,
The van.
Community Inclusion.
Inclusion Club.
The Inclusion Club. Otherwise, I think just dividing up between 5,000 on the other ones.
On
Well,
what
any,
staff recommended, or
well, any of them. I don't feel strongly one way or the other, except for the two that I'm saying
no
to.
to? Right.
I have a question, something that maybe I missed. I didn't see a correction for the Iowa City Sober Living. It said the application says yes to receive city assistance, but oh wait, now I see it.
They did a
Okay.
couple years ago.
It's,
Yes.
I think, yeah, it's been a couple years, but
Okay, but it has.
And you know one thing about, and I don't, there seems to be some, in the wider community, I'm not sure how to say this, in the wider community, it seems to be a lot of, many of these nonprofits are able to do easier fundraising than others because of who they're serving. When you're talking about, sober living or people with alcohol addiction, it's not a real, can I say, popular way for, say, we're going to go raise money for that, as opposed to other populations that people are serving. So, and they've done actually a really good job of getting going.
Sober living on your list?
No,
But we had an open space.
I had an open
Okay,
seat.
okay. That's what I'll make sure.
I think I would be interested in 5,000 there
To
to sober living.
Living.
I know it's less than the ask, but it seems like the ask was sort of variable. So
And
I
it does
support
fit in
that.
well with health. It fits in very well with health.
yeah,
Yeah, I like that, and I think their request was scalable. They'll do more or fewer people.
yeah.
would you
Right,
like me
well,
to
Tom
put that?
spoke up. Any others that you feel strong on?
I have personally worked volunteer at the NAMI, and I know they operate on love and volunteers, and I know that operationally the probably 15,000 would change completely how they operate, but any lesser amount would still be significant to them. I'm not one to put a number to it, but it is.
If you wanted to put a number to it.
We did a pro bono project for them when they moved to their new location, and I was in charge of the numbers, so it was something around $3,000, and we did really change the whole space. We painted, we got furniture. We also got donations. But yeah, I remember seeing the volunteers helping us, and as we were there too, we got a lot of smiles and a lot of thank yous, and it was quite a rewarding experience for me and for us, for everybody in my team. It will be great to be able to help them again.
Do you have any others that you are, I don't know, strong on, but leaning towards, have any kind of, aside from NAMI, any of them that tug at a heartstring the right way, or you were just like, this is the best written application I've ever seen, like any of those?
Sometimes you gravitate to those who you know, right?
Not Tom, did you have any others you were thinking of?
I mean, yeah, it's very hard because there are so many different factors to balance. I'll say that I love what VNA wants to do. They've had a lot of city money, though, and so that concerns me. I think the answer to your question is I don't have any that haven't been mentioned that I'm just dying to fund. The nearest thing to that probably would be Iowa City Sober Living.
Yeah, I kind of like the idea, of programs that maybe have some establishment, but that are trying to fully make their way all the way, like NAMI or Sober Living, or and probably splitting between 5 and 7,500 between a few.
Amos, you are always a man who has an opinion.
Yes, I have.
What do you think on this? Do you have any that you really?
Yeah, I want to talk about what I was considering first. And because I used a ranking system, and I was interested in the first group of 6 because that's what the budget allows us. If you are going for equity, 5,000, 5,000. That's the maximum probably you can do. And the minimum you can do is 2 if you're also doing equity. So I knew I was not going to do 2. I was not going to do 6 probably because for some reason. So I considered previous allocations like you considered, Chair. Yeah. And I was thinking that the total amount in the past could have some effect in terms of imposing a penalty, but it can also be very biased. So I went for the years of funding, like in the chart that just went across this was, and how many years in the past 5 years have you been funded? So I was penalizing an organization if probably one has been funded for the previously 4 years or 5. So that gave me a score of 0 to 1. But also in that factor of previous funding, I was also interested in has our agency, the non-legal aid to agency, funded that organization? Because it could be that an organization might be feeling that we are so biased, we've never funded, even though it's getting money from, we don't have to probably consider them being bad in some way. I'm lacking the right word to use. But we wanted also to make sure that this agency, the non-legal aid to agencies, is also fair to the organization. So I considered in the previous years, has that organization been funded by the non-legacy aid to agencies? And you could see there was a table, I don't know if staff you can see that some have not. So that was where I was starting, my starting point. And there were organizations that really came out with that important factor. And as a result, I had like a 5. And I also considered the sectorial equity. I wanted to see what proportion is going to food, housing, and things like that. So I could give weight to those kind of aspects. And at the end, based on my ranking, I came up with the Agape. For some reason, it has been funded, but it came out as a top 6 or 5. Yeah, it just came, and I was giving it 5,000, like staff did. And then my second one, actually the first ranking, second one was Visiting Nurse Association. It has never been funded in the past.
What was it? I'm sorry.
Visiting nurses. Although, does that also come from how often have they requested aid? Because that spreadsheet does not say whether they've requested aid in the past.
Yeah, that could be an issue.
They haven't received it.
We want to know.
Yeah.
Yeah.
We want to know that, yes. So maybe that's something the office, the staff can next time help us with, yeah.
Okay, so
Because-
Agape, then visiting nurse, then
Then I also had Immigrant Welcome Network.
Yeah, that was one of my stars.
That was
Yes.
my number was 5. I also had Iowa City Sober Living. That was very strong, almost like number 3. Mm-hmm. And I think I'm almost, so Visiting Nurse, Open Heartland, Iowa Sober Living, and Agape.
did you say Open Heartland?
Yes.
Okay.
So Open Heartland. I've
Oh,
got
I've-
1, 2, 3, 4, 5. I've got 5. Agape, Immigrant, Sober,
Open.
and Open.
Wait, say that again. Agape.
Agape.
Okay. Immigrant Welcome Network, Iowa City Sober Living, Open Heartland, and Visiting Nurse Association. And Agape I was giving 5,000. Immigrant Network I was giving 5,000. Iowa City Living I was giving 7,500.
Got it.
Open Heartland I was giving 7,500. And
Giving
the
five
Visiting
Visiting
Nurse Association I was giving 5,000.
Would you be open and 5 across and including NAMI?
We did 5, then we have one more.
But he did 7,500 to 2 of them?
No, he
Yeah.
did too, that's
Yeah,
it.
but if we drop
Yeah.
those down, we could include NAMI.
I don't know if the amount is going to be enough but it depends on how we vote on that. NAMI was my number 8 in my ranking, so I didn't just put it there. Yeah.
Okay.
But it depends, you know, my weights are different from what your considerations, so that's just something we can talk about.
I will
So
say that
we would have food, health, immigrant,
Housing.
Housing services and mental health
Housing.
specifically.
well, immigrant, yeah.
my slight reluctance on NAMI is that we don't have any information on the income levels of the people they serve. And I don't think that's makes a decision, but it does make me a little bit reluctant.
Can I ask what about it that like you're worried that they're under and they're serving?
So if they're serving primarily people who have substantial assets, that would be a balancing factor for me versus an agency that is serving people who don't have a lot of resources. Like I say, not a defining consideration, but
Did they apply for their peer-to-peer?
yeah.
That's because that's what they
Yeah,
do.
it was for the peer-to-peer.
Yeah.
Yeah.
So you mean like if,
Look,
You know, we ask in the application
right,
at various levels of AMI where their clients fall, and they don't have an answer to that question.
Neither does
We asked the
Agape.
question for a reason, I imagine.
isn't that kind of the same with Agape?
Yeah, I was gonna say
Yeah,
that.
yeah.
You know, I think that people who with severe mental illness would be on either SSDI or SSI, which would mean they would be,
Or, I mean, I've known NAMI clients who lived with their parents, for instance. So their household was
yeah,
pretty,
that's true. But
yeah,
the individual
right.
still would be,
Yep,
you know,
yep,
That's across.
I would assume they're adults.
right, right.
I feel
on-
comfortable. I think especially at like, it's it would be a $5,000 decision probably. I would probably agree and feel more strongly if we were talking about like substantial funding and figuring out like income levels for prioritizing.
so, well, I will say this, from everybody sitting here, staff recommendations, the top 4 are Immigrant Welcome Network, Iowa City Sober Living,
Yeah.
Open Heartland, and VNA. The next ones would be Agape and IC Compassion. If we take into consideration, Homes for Peeps, both of us had on our list, but also we had 2 very strong
I won't vote for that.
disagreements. So if I just include the ones that have not had any negatives against it, the next 2 would be Agape and IC Compassion. So, I mean, if we're talking about amongst all of us up here that have said, I mean, those and staff's recommendations, and I feel like we all agree generally that if we can do 5,000 to everybody is better than doing 75 or 10 to a couple, that would be our list of 6, would be Immigrant Welcome Network, Iowa City Sober Living, Open Heartland, VNA, Agape, and IC Compassion.
Can
Yeah,
What
Can you
was
put those
the-
in?
put those
Yeah.
up, Brian, just for what, for,
What was the reason again that staff didn't decide to fund IC Compassion?
We liked their application. There's several that we liked, but for non-legacy aid to agencies, staff typically don't recommend funding more than twice. The commission has overruled that in the past, but that's our mindset.
Okay.
Will you tell me again? I'm sorry,
has
which
that-
agencies?
It was Agape, and then the next one down would be IC Compassion. And then Immigrant Welcome Network,
In sober living?
and then Sober Living, and then down to Open Heartland, and then down to VNA.
well, Brian, Stacy just asked about IC Compassion, not Agape.
Yeah, IC Compassion, I think, has been funded a couple times through this program. Let me see.
But we also funded Agape last year.
We did.
She
Yeah,
said 2
more than
years funding.
twice.
They don't like 2 years
Yeah.
of past funding.
So I City Compassion,
I
we
see.
did
Oh,
2023 and 2024, and then last year we
Okay.
did Agape for 7,500.
okay,
Okay.
That's,
And they also
That's the
have,
difference.
when we are talking about total funding, they've received some money from climate action.
Although everybody got 2024, right?
Yeah, that's,
Yeah.
I mean,
so consider that.
Legacy funding, yeah.
Agape,
oh, that was what it
That
was.
was legacy. Okay.
you find Agape as in total amount considered in the past, Agape has received only 12,000. In the past, I see compassion. If we are looking at this past, if it really matters that past allocations matter in terms of fairness and other things, you see the disparity there. So if we have to talk
Well, I mean, they're both on the
Yeah.
list.
Yeah.
yeah, they're, they're
I mean,
both
they're
on
not,
the
we're
list.
not.
Okay.
Yeah,
I was thinking
yeah.
that NAMI was still there. And that's what, but if NAMI is not there, that's fine.
what do we got? Agape. I See Compassion, Immigrant Network.
Open Heartland and BNA.
I could go for that.
Yep.
Would someone want to make a motion to approve this recommendation as presented?
What does Tom think? He does.
Yeah.
No, I'm good with it.
Yeah, okay.
Did everyone agree? Or
I haven't had a motion.
I think we're just double checking everyone.
I didn't know if you wanted
Okay,
to say
all right.
anything else about NAMI or.
I'll move to approve.
Do I have a second?
I'll second.
Okay. Any further discussion that we can have on this slate of candidates as is? I mean, any changes that we would want to make to these five as far as changing, getting rid of any of them or giving any more discussion on this slate on the motion as presented?
No, I don't think so.
If not, I will call for a vote. All in favor of the motion as presented that we have up on this spreadsheet. 5,000 to Agape Cafe, 5,000 I See Compassion, 5,000 Immigrant Welcome Network, 5,000 to Iowa City Sober Living, 5,000 to Open Heartland, and 5,000 to Visiting Nurses Association. Say aye.
Aye.
Any opposed? Okay. There we have it. And I think it's been set up here by everybody, and I will stress it as well. There's not a bad organization in need of funding in this list, and probably this list is not inclusive of all the organizations in town that need funding. I really, the reach for your potential, it's hard to just not be like, how can I just help pay for them to get this metal roof up? Like,
Yeah.
little things matter. It'd be great if we had more funds for emerging agencies. It'd be great if we had that. We didn't, but I thank everybody for the time and effort they put into looking at these numbers. So thank you,
Well, and-
Commission. So
We had applications totaling $190,500 for $30,000 to allocate or to recommend to the council. It's hard.
Yeah.
all right, next item of business. Community Development Block Grant Competitive Funding Request and the recommendations to City Council. I believe, did you say, I think everybody scored? We had a
The first time in my
Got a
tenure here, everybody
unanimous
scored.
scoring round. Thank you guys so much.
The software was really good, too.
I really do like
Yeah,
that.
yeah, it was great.
I was
I'm
worried
glad to
it was
hear.
good.
No, it was really smooth.
It was very easy.
Scores are pretty similar, too, really.
Did
I
didn't, I don't even, do you have all of our scores up? I mean, I think my only thing is I understand staff's recommendation and for the reach for your potential. I am of the opinion that for $20,000 that we give them that money. I just have a hard time believing they can't get that project finished with 20,000. So that was my only recommendation change to staff, was just in addition to fully funding the other two that staff recommended, is that we go ahead and fund the reach for your potential one. I do understand staff's concerned about being able to finish it and having the funds available if they don't get the rest of the money, but I just really, sometimes I'm like, I'm gonna throw the dice.
All of these, every application requires Davis-Bacon, correct?
For the public facility projects, yes.
So Davis-Bacon is the labor law, wage law. And because I would like, and how much money do we have available? We don't exactly know, correct?
We don't. We've estimated for public facility projects that we have about $150,000 available.
Okay. So that doesn't include,
That doesn't include the rental. It's
okay,
$290,000 for
yeah,
that.
okay. Well, I think if Reach for Your Potential and the neighborhood centers can do the Davis-Bacon requirements, or can get somebody to help them do the Davis-Bacon requirements, I say fund them.
Yeah, that's where I was at.
They're going to have a contract. They know what they're going to have to do with the contract. You know, it could be some work for staff to help make sure that they comply with everything, but
We're used to it. That's what we do.
And I think the concern was for Reach was not as much the Davis-Bacon stuff. It was whether they were going to hit that 80% AMI number.
Yes, that issue is
just-
particularly stressful because when we have something like that unfold where HUD would say, you need to repay this money, we're repaying that from local funds. So that's coming out of the city's pocket.
But Reach would then have to repay it, right? We would go
Right.
back to Reach and be like, hey, guess what?
The city
Like,
would have to
yeah.
sue,
Yeah.
yes.
So,
Right.
in which case, once again, 20,000 is enough that I feel like that's something that Reach can, if Reach had to go get it together, they'd get it together, but
And their calculation was at 52%. So they technically, based on
Right
how
there,
it's
yeah.
submitted, they were meeting the requirement.
so. Yeah, so that was my only real change to the staff recommendation. I agree wholeheartedly with the rest and
Yep.
and with Mary Ann, which is it just makes sense for that pool we have.
well, and
It's almost unfortunate that we don't have anybody else that was able to submit for any kind of public facilities,
well, we're making a recommendation to the council, so they
Right.
can do whatever they want.
whatever they want,
Which,
but yeah.
but then also, non-performance requirement that the projects would have, according to their contract, are monitored. So, if they don't perform,
Right.
then we don't give them the money.
Right.
So, the contracts are pretty big, you guys. They're federal contracts.
They're hefty.
And it has happened before with a public facility project where we had to come back to HCDC and say, we
Yes.
can't get this
Yes.
to work. And then HCDC had to recommend that the funding was recaptured. So
Reallocated.
it's rare.
Wasn't there a church kitchen remodel?
Yes.
Like early
It was
in
for
my
a
time.
child care
that-
center.
child
Yeah.
care
It's
center.
rare, but it happens.
First meeting ever. Take the money back.
Take the money back, yeah.
Yeah.
Does anybody else have any thoughts? Does anybody feel strongly about not funding fully?
No.
No, I was coming in to say we need to do at least 10,000, if not the full amount. I was like, you need to give them something.
I'm just trying to understand the risk, and I guess I'm getting comfortable with it. We would have, if they didn't meet it's the AMI requirement
Right.
we're worrying about. If they didn't meet that, we would ask them for the money back. That would be a bad look. That wouldn't be nice.
No, yep.
But that's, I guess, real, and we might or might not get it back from them, but it's $20,000.
Well, I would argue if we don't get it back from them, it will be really interesting to see of any future applications for grants they submit to
Sure.
the city
Sure.
moving forward, right? Because at that point,
Yeah.
yeah,
That-
no more legacy, no more emerging, no more nothing. So,
Right.
yeah.
Yeah.
Just a question. Do you think they're aware of that requirement that if they don't meet the MI reach, they will have to surrender? Are they aware? Was that in part of the applications? I don't have that information with me right now.
Yeah, it's a part of the applicant guide that we do, and then we cover that also when we do kind of the applicant workshop training for people that are applying for funds. We would make sure that everyone is extremely aware of it. We, I think, included it in the Q&A as well, so I know that we've covered it in a couple
Published,
different ways.
Okay.
I will also say, just full transparency, if the city has to repay funds to HUD for any projects, it also increases our monitoring risk. It's a red flag with HUD, so not to say that that changes your conversation, but I just wanted to be transparent with that as well.
Sure we know all the risks. And I take Mary Ann's point that this is a recommendation to council. They might be in a
Right,
better position
yes.
to assess the willingness to take that risk than we
And
are.
Reach has been around for a long time. I mean, you know, I think they
Exactly, yeah.
think they can get
Yeah,
the people they need,
this
yeah.
is a sector they are in childcare they are entering that probably they don't have much experience with. So it's an issue of concern though. But I know there are so many children out there that are looking for affordable childcare. So, and if there another opportunity available somewhere, and Iowa City is growing, a lot of refugees and immigrants are coming. Some of them want to go to work, go to school, and childcare becomes an issue
Yeah.
of whether to go to school or go to work or not, things like that. So we let's hope. That's why I decided to give them full, just hoping that that's just going to be another space.
And,
And,
and it sounds like we're all pretty much, it doesn't sound like there's anybody that disagrees with
I-
what you're saying either, so.
I took a look also, so the insulating, the attic and the roof, or the new roof, and the savings in energy, and then I looked at their financials and their liabilities, and it's they can repay it.
Repay it, yeah, that was where I was at.
They're sizable enough organization that it's.
Well, I would, in that case, if we're somewhat all in agreement, I would sure entertain a motion to approve the amended CDBG competitive funding requests and make the recommendation to City Council that all three applicants be funded fully.
So moved.
Can I get a second?
seconded.
Any further discussion? Didn't sound like. So, all in favor?
Aye.
Any opposed? Okay.
Wow.
All right. The last item on the agenda, staff and commission updates. Do you want me to go first, Bree? And are you, okay.
Yeah.
I have just two things. First is I had a handful of colleagues in property management, landlording business reach out after the last meeting. Just one of the things that was discussed was there's the spin down. I believe Erica mentioned there's the discussion of doing a spin down to buy down the rent on the units. I think that were up, and there was something about 150 per unit to spin down rent. I had, like I said, I had three different people. One of the emails that was really well worded was, if we're doing that, is there a point where we should look to take that $5 million that we're going to be spending down towards rent? And why wouldn't you put it towards RFPing an old apartment building to buy in that area and be able to provide, instead of providing 35 households for 20 years, you could, buy a whole apartment and help 3 times as many households. Just wondering if that's something you could talk to Erica about and see if that whole spin down, how does that spin down money that we were talking about, that she was talking about?
The fee and lieu money?
Well, yes, that she was talking about using it to spin down because there's the one that's almost up, and whether they continue to maintain it, but the rents were going to be different. And she was talking about using the fee in lieu of money as a spin down to pay the difference in rent between what they're getting and what the market rate is. It's in the minutes.
What in it?
Yeah.
I think I feel like there might be some misunderstanding here, and this isn't my normal wheelhouse, so hopefully I'm not speaking incorrectly, but my understanding of the fee and lieu money is that it's going towards a project.
I believe that was part of it.
The fee in lieu is for either acquisition or rehabilitation.
Yes, that's my understanding as well.
Not-
Construction, yes.
But they can't,
Not for rent.
because I've asked city staff this several times, can you use it to lower rent?
I think the
Without-
buy down of rent might have been an expression as in like, we're investing in this project to essentially buy affordable housing units. I don't think she meant it literally as in rent assistance.
I think the argument would still be made then, why do that versus just doing an affordable housing unit?
Well, that's what they,
You have an offset. Once again, I had, like I
That's what
said,
they're
I had
proposing.
5 different people reach out after that meeting who listened to that meeting and read the minutes, and all of them read that the same way.
okay, well.
So that's
maybe-
my concern, and that's why I brought it up. Just
How about?
if
then-
Erica can double check
we
and
can
just
get
get
some
clarification.
Yeah, if we
that's what
could, if
need.
you have any
Yeah.
messages or anything to forward along as well,
And
we can reach out to
I've got some
anyone.
emails.
Okay.
So many emails. The other one, I would love to just put out in front of you. I ran into a guy named Tony Jacobson's out of the Fort Dodge area, and Nathan Faisalt and I. Nathan Fasalt from Pace Property Management and I were at a legislative briefing meeting, and this guy is the president of Landlords of Iowa, but he's also a landlord. But Fort Dodge Rental Housing has this really interesting 4-star system for how they do rental permits, which is, right now, anything that is 4 units or less in Iowa City gets inspected every year. Every year. The city between 5, and right now Stan's office, I think, is 7 months behind on inspections because they had the 2 people leave at the end of the year last year, so they're still training up new people. But Fort Dodge is really interesting. So they have a system that if your property passes on the first inspection, meaning inspection comes and it passes, there's no issues. You do not have to be re-inspected for 4 years. If you pass on the second inspection, it's every 3 years. If it takes you 3 inspections to pass, it's every 2 years. If you can't get your stuff right, they're going to keep coming back every year until you move up the star system. And then if you can't pass, then you, just like you do here. I'm going to leave this with you. I just printed off a copy. I don't know if Stan's aware of it. I know part of our directive here at the HCDC, and it's something we've never addressed, is to, make recommendations about rental permit and the rental inspection process. I just found it really kind of a cool idea. I mean, I don't know that we ever want to go 4 years on anything, but if it's a situation where a household or a duplex that every year is having these inspections are coming out, and 9 times out of 10, it's a tenant who hasn't replaced a smoke detector battery, there's no need for Stan to keep sending his guys or his gals the staff out every year for these properties when they could be addressing the problem properties. So just an interesting, we can't talk about it, discuss it
Yeah, I'm
per
happy to
se,
pass
but
that along for you.
I just wanted to pass it on, and maybe at some point we can put it on the agenda. Is there any other thoughts from commission? Any other?
There was another
There
agenda item. I
was?
was a little confused. Agenda item number 7.
That's just staff and commission updates.
Yeah.
Okay, well, there was there's a
We did
report from the Housing Fellowship.
Oh.
Was the Housing Fellowship report just for our information? It wasn't really an agenda item?
Right, not an agenda item, just a project update to kind of show what's going on with some of the projects that HCDC has recommended funding for in the past. Sometimes you guys don't always get to see the fun side of things, but it's fun to see those projects come to fruition. So they submitted an update about a couple of their recent projects.
Is that part of your staff update?
A little bit. I have a couple other things.
Okay. All right. Well, I will hand it over to you if
Okay.
it doesn't sound like anybody else had anything.
I have,
What
maybe it's
Amos
not
does.
relevant, maybe it requires a motion for agenda, but the neighborly software, I was wondering, it was very interesting and very nice to use, and I was wondering application of that or modification of that to the other allocations we are going to do. I don't know if you have tested that and the difficulties. That's what I was also trying when I was using for this our non-legacy funding, the 30,000. I was trying to do anything near to that, but it was time consuming. But I think it's very possible to make our lives easy, although it's never perfect because sometimes there are considerations that the model or the software you're using does not consider, like the question of the van for Iowa City Inclusion Club. Yeah, if you want to consider getting a van and with another person who just needs money, those things are different. 5,000 doesn't help a van, but so those kind of things are there. But I think the software increases consistency, and but we can modify just like we did in the previous one. This is my question.
Yeah, I'm glad to hear that the software went well. If you are ruminating on it and you think of things that would have made life easier with the software, let me know and we can make those edits for you. I personally would be very interested in using it for things like the non-legacy, just to see what that looks like. The difficulty with that is the next funding round that we do with the public services will be through the joint application. So all of the other funders in the area, Coralville, North Liberty, Johnson County, we all use the same application, and it's through United Way software. So that will be a little bit, it's a different software platform. I know they're also interested in potentially looking at other alternatives, but I'm glad to hear that it went well. Am I hearing you right that you'd be interested in using software for some of the other things like non-legacy?
Yes, because I don't see what the United Way software looks like. I don't know how the risk associated, the inbuilt problems that are in there. Yeah, this one I was able to see very well. And even though the software we used had a problem with the risks, we were not accounting for risk in these three applications, but it was not going to make a difference. So I didn't worry much about it. But the risk could also be incorporated, yeah, because you gave us for each applicant there was a risk associated with them, and actually you gave us counts, so number of counts, level 1, 2, 3. Mm-hmm. But in the software, it was just left for us to put something there or whatever. Yeah. And those are the things I'm worried about. When we go to the joint allocations, there could be things that probably our commission wants to talk about or worried about or wants to shape or modify, things in a way that, and I don't know how transparent that's going to be too.
Yeah, that's certainly feedback I can pass along. We meet as joint funders pretty regularly, and I know software has been part of the conversation, so I'm happy to keep having that conversation. I think that's good feedback based on the risk pieces that are missing too. We can work on that for next time with the CDBG.
Maybe do the applicants know how we rank? Like if they knew, like so they're not missing any information. Do they know how we're gonna rank it? Right.
Yeah, they should have.
Yeah, we try to make that public. It's in the applicant guide, and then when we do that applicant workshop, we try to encourage people like score your proposal, so it's not a surprise, so you can kind of self-assess and maybe see where you could improve. So we try to publicly put that out there for CDBG, and then also when we do aid to agencies through the joint application, that score sheet will be available as well. This non-legacy round is the only one that doesn't have a score sheet. Mm-hmm. Other updates that I have, I mentioned already that we don't know our allocations from HUD yet. Typically, they post those in February. The rumor mill is that it will be April when HUD posts that. So we're expecting delays. Typically, the next step would be we would take your recommendations, we would put them in our annual action plan, and then we would bring that to you for consideration, and then they would go to City Council for final approval. That typically happens in April and May, so if we don't know our allocations until April, that process is going to be a little bit delayed. So I can't give you an exact time frame when we'll be bringing you our annual action plan, but hopefully it will be soon. The non-legacy recommendations generally go to City Council at the same time. They're not part of the annual action plan, but we usually bring those two budget items together. April, we have a somewhat open agenda. If you have areas of interest that you might want a presentation on, staff can try to make that happen. If you would like to take a month off, that's fine as well. Kind of looking for direction from the commission if there's things you're interested in. Since the schedule is off, we have a little bit of an unexpected open meeting.
I'm all for not having a meeting. Just me.
I think it would be interesting to talk about how those funds could be used. Like if there isn't any new project that requires or applies for the city to contribute to low-income housing funding, how else can we allocate that money? I think that would be interesting to discuss.
Okay, I think that might be good to revisit as well. If the public has questions, we can put that on the agenda, and they are certainly welcome to attend and listen.
Great idea.
Will this be the 20th?
Yes.
Okay.
That's the end of my updates, but I did want to say thank you for scoring again. That was very exciting to have full participation. Last year around this time, things looked very different, so I think the commission's in a very good spot, and we appreciate that.
Can we also probably hear from the Housing Authority on the effectiveness of the promotion that they did for vouchers with the landlords? How far it has gone?
Do you mean the changes that were recommended tonight, how that
not
goes
tonight.
later?
No, earlier on, maybe last month, the city of Iowa City decided to try to promote vouchers to the landlords, to encourage
yeah,
landlords.
sure.
Yeah, can we get an update on that? And if that, we want to see if that instrument is working or not, or do we need a study to learn better what the landlords care about?
Yeah, that'd be great. I will ask Rachel. If I can't make it work on the April agenda, I'll definitely keep that on my radar. The other thing that might be of interest to this group is our tenant-based rental assistance program. That's kind of a newer program through the Housing Authority, and she might be able to give an update on that as well that you might find interesting.
Anything else? Anybody have any? Okay. Well, I would sure entertain a motion to adjourn at 6:32. I'm sorry I didn't make it in your hour. I tried. 6:32. Anybody? Can I get a motion to adjourn?
I'll make a motion to adjourn.
Second.
Second.
A favor.
Aye.
Opposed? Awesome. Thanks, everyone.
Thank you.